Hello, my name is Amy Denver, and I'm the Director of Social and Health Services for Highline School District. And if you don't know where that is, we're the district that surrounds the airport and goes over to Puget Sound. We're going to talk to you about our Coordinated School Health Advisory Council and basically how we formed it, what kinds of things we're doing. And we thought we would start out with a digital story to give you an idea about our background in it and also to see one of the products of our council. So, Sarah, are you able to turn that on? Thanks. I chose to become a nurse because I wanted to help others improve their health. I came to Highline because I saw it was a district with heart and that they were dedicated to helping their students achieve success. We all worked hard to impact students' health. It felt like disciplines were not talking together. We were paddling hard upstream and were stretched thin in many areas. About 6 years ago, a group of us learned about the CDC's model of coordinated school health. This model coordinates the many parts of school and community health into a systematic approach. The facts show you can't have good academic achievement without the whole person being ready to learn. Hearing about this got us excited. All we had to do was to figure out how to make this happen in the district. With the help of grants, including communities putting prevention to work, we were able to support our dream of coordinated school health. The cities in our district came together with district staff to develop a coalition to look at policy changes that will promote healthier communities and schools. Highline now has numerous programs that are system-wide changes to improve health outcomes. Several elementary schools have moved to recess before lunch programs. We have new nutritional signage in our cafeterias and a fresh fruit and vegetable program to give our students more of the nutrients they need. People in our district are working together. It's been so powerful that they don't ever see themselves going back to that old model of working in isolation. Students and staff will continue to reap the benefits of this coordination because it's not about doing more with less, but doing more differently. I'm next. So I wanted to tell you, it's Lauren who is the creator of our digital story, and so we're really happy to have her on our team. Well, so that is the truth. In 2007, we were the recipients of the Steps for a Healthier U.S. grant from the CDC, and it was the King County Public Health that was really instrumental in giving us the initiatives to start working on decreasing the disparities in health around asthma, obesity, and diabetes. And so we were given a lot of freedom, actually, to start to think about how we could do that. And we started out the very first year with a staff wellness fair, which has continued since. It happens every August, as well as we did some activity challenges for the staff. So we really wanted to get the idea of health energized in our district amongst everybody. And it was very powerful. The district staff kept saying, nobody's ever given us this kind of pat on the back and told us to take care of ourselves. So that gave us a little bit more impetus to start talking together. And then we went to a Healthy Schools Summit and heard about coordinated school health. And a group of us did literally sit down and say, wow, this is so powerful. It makes so much sense. Why can't we come out of our silos and start working together? And we did, and we'll tell you some of the things that we've worked on together. We were then thinking, well, how do we make it happen? Our district had really decreased funding. They weren't going to support us putting any extra money into health when academics was everything that they needed to do. And so we figured, let's talk about this. We looked at just how do you make system changes when you're kind of in a silo yourself amongst the educators who are talking only about academic achievement. And we said, well, we need to do this really slowly and really strategically. We need to talk about things that will get their attention and use every opportunity to bring up the word. So we did a presentation just to let them have an idea about some of the statistics that were out there about connecting health to academic achievement. And there was a lot of disbelief in the room. There was a lot of worry. And our direction was to don't bring any more financial burden to the district because of this, and not time burdens either. They didn't want our staffs to have any more add-ons. So we had to really start promoting it and getting people excited like we were to want to join us and make a council and start talking together. So we finally got permission to bring together an advisory council, and part of that was because grants were coming up that they really wanted around drug and alcohol, about bringing our preschoolers up to date, and a lot of the monies was going to be dependent on whether or not we already had a system in place of making people collaborate and talk together, rather than all of a sudden getting the money and trying to figure out how to make things happen. So they started writing us into their grant proposals that, well, we have a coordinated school health advisory council, therefore we're really good candidates. So that helped us a lot right there. And then we had to figure out, what are we going to do in terms of our organization of our council, and how are we going to get people who already have a heavy burden, like principals or teachers, to join us. And we came up with little tiny bits of money to help pay for subs for a couple people. Wasn't much at all, but we got principals who suddenly said, I have a passion for decreasing obesity. I want to join you, but I just can't come that often. And I won't be able to do a whole lot of outside of work on this. So our structure is what's on the next slide, which is me. That's supposed to be doing that. Sorry. So it actually came together naturally, and then we had to think about what is it that's working for us, and how do we as a team understand what we're doing. So we have a full council which has about 30 people on it. It's got public health, it's got community partners, it's got teachers, it's got parents, it's got nurses, social workers, nutrition services. We've got people from HR there really trying to look at ways to benefit the staff. And we finally got a secondary principal and an elementary principal. We only meet as a full council 4 times, and that's our guarantee to the members, that we don't want them to feel that they're committing to too much time. But they do commit to answering things on emails and keeping the word out there. We have a steering committee, which is the group that started it originally. It's nutrition services. We've got somebody from the nursing group, myself. We've got my compliance specialist. We have social workers, and we have somebody from public health who's also a health educator. And we really carefully plan our council meetings and our next steps so that it makes sense and it keeps people engaged. We don't want people to feel like they're coming to a meeting just for a meeting. We want them to see that they're eventually accomplishing something and that it's something that they had a passion about. So we were also very fortunate with the CPPW grant to get some funding to help us get facilitators, as well as a public health person who is skilled in that area helped us as a council start to develop what our mission was, what our vision was, and what our next steps would be. We broke up into work groups based on what the council recommended and came up with as initiatives. So we had a data group, we had a staff wellness group, we had a nutrition and wellness policy group, and those groups took it seriously and went out, worked, and came back and reported to the council on what they found and what kind of systems they had put in place for district staff and parents to get information about health in the district and community resources that they could tap into. So that's basically what we had. The steering committee really is the motivator. They're the ones that plan the meetings and get the information out, and they're kind of the filter for if grants come up, they can come to us in between the council meetings. And then I'm going to ask Chris to go on with what she has for nutrition and wellness. You want to say who you are?
I will. My name is Chris Neal, and I'm the Director of Nutrition Services for the Highline School District, and I've been an active member of the Coordinated School Health team since its inception in 2006. And we have benefited greatly from the grants that came to the district, the CPPW, Communities Putting Prevention to Work, and the Steps to a Healthier U.S. really got us started. And it followed nicely the Child Nutrition Reauthorization Act, I believe it was 2004, was the beginning when it said the district was required to have a wellness policy and nutrition standards and procedures to go with that policy. So we expanded our team and we brought together a wellness community, basically, that included parents, students, coaches, teachers, counselors, social workers, anyone who we felt had a vested interest in seeing the district develop a meaningful wellness policy and nutrition standards that we could apply district-wide. And we did develop those standards, and in answer to the lady back there about vending machines, our business services office took those nutrition standards and wrote an RFP for vending machines district-wide. So all vending machines in the district that are available to students follow those nutrition standards. There's no carbonated drinks, there's no sugar in the drinks. It's a great policy, and the district has backed it. Then in 2010, when the Communities Putting Prevention to Work grant came available, and I believe the reason that Highline has been so involved in these grants that have come through King County Public Health and the CDC is that we're a high poverty district. 72% of our students qualify for free or reduced meal benefits, which is quite high when you realize how close we are to an urban area. But because of that airport, and we are a point of entry into the United States, we're highly diverse and have a high poverty rate. So through the CPPW grant, we were able to develop nutrition signage. So on your screen, you'll see our logo, which says serving healthy choices, and this logo is on the employees' shirts, on their aprons, and on the trucks, which travel throughout the Highline School District, which covers 5 municipalities in our area, and so we are highly visible. And then with the Healthy Hunger Free Kids Act of 2010, we were required to develop signage that told students what was required to make a healthy meal. So I believe if you're looking at it on the right of your screen, that was the signage that was created to tell students that they were required to pick 3 items to make a meal, and there was a requirement that they take a half cup of fruit and or vegetable on their tray to make a meal. And I'd like to call your attention to the website, which is listed on the bottom of the screen, that you might want to check out the Highline Nutrition Services website. There's a lot of good information there. And as part of the signage, we developed the icons, which are on the right, and the signage told the students which were healthy choices to make: heart healthy, 30%, no more than 30% calories from fat, 10% saturated fat, no trans fat, what was high in vitamins and minerals, high in fiber, and high in calcium. And this is an example of our fresh fruit and vegetable bar, and there are clings on the salad bar that label the salad bar for those icons. And this last slide, this happy group here, is the group of 14 elementary principals who were recognized with the Healthier U.S. School Challenge Awards. We now have all 18 elementary schools who have achieved this voluntary certification, which means that we have 7 of those schools who received the Gold Award of Distinction, and I have to say there's only 424 schools nationwide who have achieved that distinction, and we have 7. We have 8 elementary schools with the Silver Award and 3 with the Bronze, and they were recognized at the school board by OSPI and King County Public Health, and they are a smiling, happy group. We've been very pleased to be part of Coordinated School Health in Highline.
So the next thing I wanted to talk about was our recess before lunch program. When we got the CPBW grant, we had 5 original initiatives that we were supposed to accomplish, and one of them was recess before lunch. The goal was in as many of the elementary schools as possible, if not all. We have 18 elementary schools in all, and we were able to get it in 15 of those. It was quite a struggle, but once again, we tried to be strategic about who was in charge of it, and we found somebody who was passionate about it and also happened to be our assistant communications director, who's brilliant at convincing people to do things. But not only in her communication skills, but just creative ideas to get the principals on board. We had very limited monies that we could offer as incentive to the schools, but when we did an evaluation with the help of the public health, and what we came up with is a definite increase in the milk consumption, which the Dairy Council was very excited about for us. And also, we found out in the afternoon visits to clinics that those were decreased, so the kids were in school and ready to learn more. The teachers, about 58% of them in our study said they really liked it. Their biggest concern was supervision was hard, and that's something that's a cost factor. So we still need to figure that out, but the grant is gone and we still have recess before lunch in all 15 of those schools. So they found some great value for that.
My name is Lauren Donlin. I'm the Health and Social Services Compliance Specialist, and I'm going to talk about some challenges that we had. Obviously, you can't do anything without some challenges. So the first one was the actual coordinated school health model from the CDC. We had to mold it to our district to fit our needs and our demographics. So it's a district-wide council model that we use. The second is time. Council members donate their time to our cause because they have a passion for coordinated school health. The next is funding. So apart from the grants that we've received, there is no budget for coordinated school health. So that we only have 4 meetings a year, and we have to work together and collaborate in order to keep everything going. The next one is outreach. It takes a long time for community members, for parents, for even our staff to be invested in coordinated school health and to understand what it is, what it means, and why it's important. The next is staff turnover. We have had 3 superintendents since we started implementation of our council, and it just takes more buy-in from upper administration, especially the superintendent, and us just really promoting a lot. The next is opportunities. Amy talked about grants, things that we lost opportunities because we didn't have a coordinated school health structure in place. But now we're more organized and we can go for those things and be ready to receive the grants and run with them. The next is our structure. We spent a long time building our infrastructure for the council, probably about a couple years doing that. We wanted to create a shared vision and mission statement so that everyone on the council knew why we were doing what we were doing. We developed a crosswalk speech, which is on the bottom of the page. It's working together to improve district outcomes through health and wellness efforts. So it's a crosswalk speech meant to, if someone were to ask you what coordinated school health looks like in Highline, that's what you would tell them. And the last is passion. It's taken several years for us to build the council and keep it going without funding, and that's why we have a steering committee and a passionate administrator and people on the council to really stay motivated in our goals.
And lastly, I'm Jean Blackburn, the school social worker, and also I'm the McKinney-Vento liaison for homeless children in the school district. So we have some tips for you. To promote coordinated school health, we feel like it has been helpful to have a champion to start and build momentum for the project. And we really feel like Amy has been that for us. She goes to multiple meetings as the director of nursing and social work services. She interjects coordinated school health whenever she can. And all of us on the council some of us have multiple school assignments. So any opportunity that we have, we bring up coordinated school health as how it can help streamline services, avoid duplication, and generally help work more efficiently. We inform staff that coordinated school health is relevant and capable of creating change. We're building relationships among ourselves, among the council. We're building relationships with our upper administration, which is very important. And also now we're turning to building those relationships at the school buildings themselves. How could they maybe have a coordinated school health council on site? It's system change. It will take a while, but we hope that it stays because we feel like it's an effective way to do our work, which is exciting, difficult, but challenging sometimes. We try to align our work groups with our district initiatives. Our superintendent has put out a plea to schools to decrease and to eliminate school suspensions. We have one of our work groups is on aggression and violence. Hopefully our work will help the schools to decrease those suspensions and bring some best research practices to schools. We use a model of planning, doing, checking, acting, and repeating. It's a fluid process. We meet 4 times. We discuss what we can work on realistically. We evaluate that, and hopefully in the coming years, we'll have coordinated school health every year. So thank you very much.